about this for a second. How do we usually ask kids questions, especially, important ones about how they're feeling about their health? We tend to assume they get what we're saying, right? That our words land the way we intend them to. But do they? Really? Welcome to the deep dive. Today, we're jumping into some really fascinating research. It pulls back the curtain on how experts make absolutely sure health questionnaires actually work for kids. We're looking at a study. The paper's called Cognitive Interviewing Methodology in the Development of a Pediatric Item Bank, a Patient-Reported Outcomes Measurement Information System, PROMIS study. Quite a mouthful, but the work is crucial. Our mission here is to unpack the surprisingly complex process behind creating health tools kids can actually understand and use reliably. We'll dig into how kids communicate, why tiny word choices matter so much. Honestly, it might make you rethink how you ask questions yourself. It's definitely more involved than you'd guess.
It really is.
Yeah.
And what's super interesting here is that it connects directly to something called patient-reported outcomes, PROs.
Yeah.
In healthcare now, PROs are becoming, well, essential. They're about getting the patient's own perspective, how they feel in their own words.
Right, hearing it straight from the source.
Exactly.
But getting that information from kids, say, ages 8 to 17, that seems like where the real challenge lies. Their understanding of language, of concepts, it's still developing so fast.
That's the core problem. How do you design questions that truly capture what a child is experiencing without them misinterpreting it?
Yeah.
Or just telling you what they think you want to hear?
Yeah, because if you get that wrong, the consequences could be huge. Misdiagnosis, maybe the wrong treatment.
Precisely. Or even just misunderstanding the scope of a health issue in kids because the questions weren't clear enough.
Okay, so that brings us to this PROMIS initiative you mentioned.
Right. PROMIS Patient-Reported Outcomes Measurement Information System. It's a big NIH project. Its whole goal is basically to improve the science behind PROs, especially for chronic conditions.
Yeah.
They want to create these dynamic electronic item banks.
Item banks, like huge libraries of questions.
Exactly. Validated, reliable questions tailored for different groups.
And the study we're diving into, it's part of the PROMIS Pediatrics project, focused just on kids.
Yes. Specifically developing these item banks for young people, covering really critical areas. Things like physical functioning, emotional health, social health, fatigue, pain, even asthma symptoms.
Asthma makes sense given how common it is in childhood, so a really broad look at health.
It has to be, but the underlying point is clear. You have to use language kids understand. You can't just shrink down adult questionnaires.
Okay, so that's the challenge. How do researchers actually figure out if a kid really understands a question? It can't just be asking, did you get that?
Oh, definitely not. It's much more nuanced.
Okay.
They use a method called cognitive interviewing.
Cognitive interviewing. Okay, what does that involve?
It's a qualitative technique.
Yeah.
It's designed specifically to get direct feedback from the person answering the question, feedback on the wording, the format, and crucially, if they understand it. It's literally trying to figure out, what's going on in their head as they read and answer. What do they think the question means?
So it's like looking under the hood of their thought process, not just checking the final answer.
Exactly. There's this cognitive process model behind it. Researchers look at how kids comprehend the words, how they pull information from memory to answer, the judgments they make, and then how they actually form the response.
It sounds really detailed, like peeling back layers.
It is. It digs into each step.
And the PROMIS study used a specific technique for this, something called respondent debriefing. How did that work with kids?
Yeah, respondent debriefing. So the kids first fill out the questionnaire, just like normal. But then afterwards, a trained interviewer sits down with them and goes through it systematically. They'll ask things like, were any parts tricky? Or what did this word mean to you? Or did the answer choices make sense? They also ask for just general thoughts.
Okay, so it's like a detailed review after the fact, a post-game analysis of their thinking, like you said in the outline.
That's a good way to put it. It really scrutinizes every part of the question from the child's point of view.
That sounds incredibly thorough and probably pretty time-consuming. How big was the study? How many kids? How many questions?
It was definitely a significant effort. They did 88 cognitive interviews in total with 77 different kids and teens, and they started with a pool of 318 potential questions. This was done across 2 sites, UNC and Texas A&M Scott and White. So, yeah, a major undertaking.
77 kids. Who were they exactly? Beyond just being 8 to 17, what did they look for?
Good question. Selection was key. They needed kids who spoke and read English, obviously. And ethically, it was really important the kids gave assent, meaning they agreed themselves.
Right, they had a say.
Exactly. and their parent or guardian gave formal consent. That's crucial when working with minors.
Definitely. And I imagine they needed diversity in the group too, right? To make sure the questions worked for lots of different kids.
Absolutely critical. They use something called purposive sampling, which basically means they intentionally recruited a diverse group, kids with asthma and without, since asthma was a focus. They also balanced the ages within that 8-17 range, making sure they had younger kids like 8-9 and older teens for each topic.
Okay.
And they balanced for socioeconomic status and race ethnicity too. The goal was broad applicability.
Makes sense. And the interview itself, you can't just stick a kid in a sterile room and expect open feedback. How did they make it comfortable?
They really thought about that. The environment was deliberately child-friendly. The interviewers were trained pros, social work grads, or research nurses who already had experience with kids in research.
So people who knew how to talk to kids.
Yes. They did the interviews somewhere, comfortable, private, offered breaks, and they gave each child a $25 gift card for their time and input. It showed their contribution was valued.
That's a nice touch. Did every kid have to review all 318 items? That sounds exhausting.
Oh, no, definitely not. That would be way too much. Each child reviewed about 30 items, focused on one or maybe two health areas.
Okay, more manageable.
Much more. But the system ensured that every single item was still reviewed thoroughly by at least 5 different participants who fit the profile for that question. So deep feedback without burnout.
Smart. Okay, so they did all this careful work. What did they find? What were the aha moments when the kids started talking?
Well, first off, the good news was that even kids as young as 8 generally understood most items. About 92% were kept for the next stage, field testing.
So kids can talk about their health effectively.
Absolutely. But the really valuable stuff came from the 8% they didn't understand or found confusing. That's where the gold was.
Right. So give us some examples. What kinds of words tripped them up?
Okay, this is where it gets really interesting. Like the word irritable. Kids often didn't quite get it, or they preferred simpler words like grumpy or cranky.
More concrete.
Exactly. Exhausted often became just tired. How severe was clearer as how bad. Social activities, it was a bit vague for some. It often got changed to things like activities with friends. Makes it tangible.
Yeah, I can see that. What else?
Even acronyms. A younger child didn't know what ER meant, so it became emergency room or hospital. And get this, even snaps, like on clothes, was confusing. Kids suggested zipper or button.
Wow, really? Just shows you can't assume anything.
Right, and even a common word in instructions, difficulty, worked better as trouble for the younger kids.
It's amazing how these seemingly small changes make such a difference. It really hammers home how literal kids can be, or how their vocabulary is just different.
Totally. And it wasn't just single words, there were patterns. A big one was moving from abstract ideas to concrete experiences.
Okay, like what?
Like the word relationships. A bit too abstract, especially for younger kids. So items were revised to things like how I got along with classmates or losing a friendship. Much more specific, grounded in their lives.
Makes sense.
Or take a phrase like, I felt like I did everything badly. What does badly mean? Poorly. Or like getting in trouble.
Yeah, ambiguity.
Right. So based on feedback, it became, I felt like I couldn't do anything right. Much clearer about the feeling.
You also mentioned ambiguity of scope earlier, where words mean different things to different kids.
Exactly. That was another major category of confusion. Vague phrases caused all sorts of interpretations. Like activities, does that mean sports? Hobbies, school clubs, big difference.
Yeah.
Or walk, that walking down the block or walking a mile. Depends on the kid, their age, where they live, go out. Could mean playing in the yard or going out to dinner with family. Completely different context.
Changes the whole meaning of the question.
It really does. Or I felt terrible, physically, emotionally. So they had to clarify, like adding context. My body felt bad when I was out of breath. Narrows it down.
It's fascinating how much hidden meaning or lack of clarity can be packed into simple phrases. Did the kids comment on anything else beyond the words, like how the questions looked?
Oh, absolutely. The format mattered too. Kids suggested making the text bigger, shortening the instructions less intimidating, and putting the time frame, like in the past 7 days, in bold so it really stood out.
So presentation counts just as much.
It seems so,
Yeah.
especially for younger respondents. It all contributes to understanding.
Okay, but what about those important concepts where maybe there isn't a perfect, simple kid word? Like I'm thinking worry for anxiety. That feels pretty crucial. You can't just swap it out easily.
That's a really sharp point, and it highlights a key tension. Sometimes, a perfect synonym just isn't there,
Hmm.
or the concept itself, like worry, is so central to what you're trying to measure in this case, anxiety, that you can't just drop it even if it's a bit hard for some kids.
So what happens then?
In those cases, the researchers might decide to keep the item, but flag it. It gets noted for extra attention during the big field tests. They'll watch how it performs statistically with hundreds or thousands of kids. It's this balance, right, between perfect clarity and measuring the essential thing.
A balancing act. Got it. So, bringing this all together, this has been a really detailed look. What's the big takeaway here? What does this mean for kids' healthcare?
I think the biggest takeaway is confirmation. Kids, even down to age 8, can tell us about their health and well-being, and their input is absolutely essential for making these tools work. Remember, 92% of the items are okay initially, but those cognitive interviews led to 35 revisions and 25 items being dropped entirely. That's significant improvement based directly on kids' feedback.
So, it's not just academic. This directly improves the tools used to assess kids' health. Real-world impact.
Huge real-world impact. The PROMIS Pediatric Item Bank is better because of this process.
And the next step you mentioned is large-scale testing.
Exactly. Those refined 293 items, shaped by the kids themselves, are now being tested with much larger groups, which ultimately means we get better, more accurate, more genuinely patient-centered ways to understand child health. It really values the child's own voice in their care.
What a process. We've really seen today how going that extra mile, being so meticulous and child-focused in designing something like a questionnaire, well, it yields incredible insights. It shows how kids understand language, how they see their health. It's a reminder about asking the right way and really truly listening. And it definitely makes you pause and think, doesn't it? About all the times we gather information from kids, doctors, teachers, even just chatting at home. If words like irritable or phrases like social activities can cause confusion, what other assumptions are we making? How often do we think kids understand us when maybe they don't quite? What stands out to you from all this? How can we get better at really hearing what the youngest voices among us are trying to tell us? Something to chew on.